We know that salt is a risk factor for the development of gastric cancer, and pretty much that is about the only cancer that we know that high levels of dietary salt intake actually increase. All the other different types of cancers, we really haven't found a great correlation between intake of salt and developing those types of cancers. In certain cultures, they use salts as preservatives, and that often is used in, for example, in Southeast Asia, for example, with pickling, for example. And folks there have an increased risk of developing gastric cancers, and we believe that may be related to the salt intake. Not an issue if you're going to be consuming salt sort of as we do typically, where you're not using tons of salt on a day-to-day basis. That has not been correlated with the increased risk of developing cancer. So in general, very high salt intake may increase one's risk of developing gastric cancers. Typical salt and low salt intakes really have no known increased risk of development of any types of cancers.
On this field, a single decision can change a game. For a man with prostate cancer, a single decision can change his entire life. While I chose surgery, a less aggressive approach called active surveillance might be the best choice for you. Ask your doctor about a genomic test that may help you make the right decision. Learn more at yourprostateyourdecision.com.